Hello, I'm Ling. Both myself and my colleague Wong Fang work closely with the medical team to manage patients in rheumatology. Patient education is one aspect that is important as part of the care we provide to our patients. We will go through the aim of patient education, the education process, what are the factors influencing adherence, common disease-specific advice to patients, and briefly on the APN services in rheumatology. Patient education is a process of providing information, knowledge, and skills to influence a change in patients' behavior, and the primary goal of patient education is to enable patients to manage their illness and maintain quality of life. Through patient education, we hope to improve patients' understanding of their diagnosis. Autoimmune diseases are complex, and many patients may not have heard about the disease and need more information to understand the disease. The level of explanation needs to be tailored according to the patient's pace. Many patients worry about the side effects of medication. Therefore, it is important to provide the patients with information on the potential side effects of the medication that they will be taking and reassurance of how the side effects are being monitored. Allow patients to clear their doubts and understand the benefit versus risk of taking the medication. We hope that through better understanding of the disease, patients are more willing to adhere to their treatment and their medication. Open discussion improves the relationship between patients and healthcare providers. Through open discussion during patient education session, we hope to increase patients' acceptance of their management plan and empower the patient on self-management. Patient education process includes the 4 steps, where there will be assessment, planning, implementation, and evaluation. During assessment, collection of data such as identifying the health problems, the patient's age, family dynamic, their financial concerns, the patient's and family readiness for information, and their emotions at that point of time are some of the information needed. With these and more that we have gathered, we can then plan the information appropriate to each individual needs. Select what to teach and decide what is important to teach. It is also important to set realistic goals with patient and family. When implementing, give clear instructions. Do not use medical jargon. Show empathy. Able to recognize patients' concerns and provide encouragement. Lastly, evaluate patients' understanding and whether their learning objectives are met. Also, evaluate if patients require any other support, such as medical social service for psychosocial support or financial support. Why aim to improve medication or treatment adherence? Patients' adherence to medication or treatment can influence clinical outcome. It can reduce risk of long-term complications, increase or maintain productivity, and improve or maintain good quality of life. We need to find out from patients what are the reasons for their non-adherence. Is the non-adherence intentional or unintentional? In intentional non-adherence, patient is aware that he or she need to take medication but chose not to take it. Unintentional non-adherence could be due to financial difficulties, busy with work or study schedule, or lack of knowledge of the disease. Non-adherence in rheumatoid arthritis ranges between 30 to 80%. Some of the contributing factors to non-adherence are fear of side effects, financial constraints, as I have mentioned earlier, perceived treatment inefficacy, or lack of social support. Some of the questions that patients commonly ask: what is autoimmune disease? Can I live a normal life? What are the medication side effects, and whether do they need to take the medication forever? Patient education has to be tailored to individual needs and delivered at the correct timing. Information has to be given in stages, example during the hospital stay, or at the time of diagnosis. Patient may require information on the diagnosis and the rationale for the many investigations that has been carried out, and what does the results mean. It is important to have a multidisciplinary approach and teamwork to ensure that information given to the patients are consistent. These are some of the common advice given to patients with inflammatory arthritis such as rheumatoid arthritis and spondyloarthritis. Patients are counseled on the need for starting disease-modifying anti-rheumatic drugs. They are educated on the potential side effects of medication and how they can manage with mild side effects, example nausea or vomiting. They are advised on the treatment plan and importance of adherence. Some advice on activities includes duration of exercise and some important tips on posture for patients with ankylosing spondylitis. Some of the potential complications are discussed, and patients are strongly advised to stop smoking and avoid alcohol. For dietary advice, patients are advised to avoid raw or half-cooked meat or eggs to minimize risk of infection and to be cautious with taking traditional medicine. These are some of the advice given to patients with lupus. Many patients with lupus are concerned over the side effects of prednisolone, and we need to manage the patient's expectations on the medication side effects. Lupus patients are always advised to avoid sun exposure. They are advised to use sunblock SPF more than 50 or umbrella or hat to avoid direct exposure to sun. Sun exposure may trigger lupus flare. For young female patients with lupus, it is important to advise them on pregnancy, depending on the type of medications they are currently on. Most of the immunosuppressants are teratogenic. Therefore, they should avoid pregnancy while on immunosuppressants. Female patients with serology positive for anti-Ro, there's a risk of baby developing congenital heart block. We assure them that they will be followed up closely by rheumatologists and obstetricians during their pregnancy. Patients with antiphospholipid syndrome have an increased risk of thrombosis and miscarriages. Advise patients on the importance of adherence to medication and avoiding triggering factors, as it can lead to complications. Similarly, for all patients on immunosuppressants, they are advised to avoid raw or half-cooked meat or eggs to minimize the risk of infection. Patients are advised to be cautious with traditional medicine. Besides patient education, my colleague Rongfang and myself also review patients at the Rheumatology Monitoring Clinic and Virtual Monitoring Clinic to monitor patients with inflammatory arthritis for drug toxicity and disease activity. We provide walk-in review for follow-up patients who come to the ARC clinic or call the clinic for possible flare of disease. These patients are seen at the APN-led urgent care clinic in consult with the patient's primary rheumatologist. There's the Rheumatology Nurse Advice line available for any clinical queries with regards to disease, medications, that patient can call for consultation in between their clinic visits. There's also a face-to-face patient counseling session at the ARC clinic, and there's an ongoing patient support group that the APN help to facilitate. Thank you. This is the last slide, and special thanks to Duke NUS Medical School.